Good afternoon. I'm calling to order the joint committees for the Consumer Protection and Commerce and Committee on Legislative Management. It is 2 p.m. We are in rooms 329. The date is Wednesday, March 29, 2023. We'll be limiting testimony to 2 minutes. For those who are testifying via Zoom, please keep yourselves muted and your video turned off until it is your turn to testify. If you are having technical issues, please use the chat function to contact our IT staff. First, on today's agenda, we have HCR 100/HR 107, requesting the auditor to conduct an analysis regarding the scope of practice for advanced practice registered nurses and physician assistants. First to testify on this measure, we have Chelsea Fukunaga, Executive Officer from Board of Nursing, with comments. Thank you. Next, we have Alani Kioki from the Executive Office of Hawai'i Medical Board with comments.
The board will stand on its written testimony and provide comments.
Thank you. Next, we have Leslie Kondo, State Auditor from the Office of Auditor's Office with comments.
Good afternoon, Chairs, Vice Chairs. Daria Goto on behalf of the Office of the Auditor. We're just here offering comments today, and I will stand on our written testimony, just indicating that scopes of practice are typically reserved for the boards, the professional licensing boards, to set. We're not certain if the scope of the work that this resolution calls for is really within the traditional HRS provisions that are assigned to the Office of the Auditor. I'm available to answer any questions that the committees may have. Thank you.
Thank you. Next, we have Laura Reichart from the Hawaii State Center for Nursing with comments.
Hi, good afternoon. My name is Laura Reichart. I'm the director of the Hawaii State Center for Nursing. And I just wanted to point out in my testimony that after last year's similar resolution, the Center for Nursing started a working group that is interprofessional. It includes APRNs, PAs, psychologists, pharmacists, and physicians, as well as representatives from the Board of Nursing. And we're reviewing the statutes as they compare as statutes that inform practice as it compares to each profession's individual scope of practice as it's established in their practice acts. And we have been communicating with Rep. Kitagawa. She introduced a resolution 2 years ago. Our plan is that after we identify how all of these statutes compare and if they may restrict access to care as compared to the scope of practice, we can come back and communicate that to you and work with solutions based off that landscape as it compares to the existing scope of practice.
Thank you. We have written testimony in opposition from the Hawaii Association of Professional Nurses, a written testimony with comments from the Hawaii American Nurses Association, Hawaii Academy of Physician Assistants, and 3 individuals in opposition. Are there any other persons here to testify on this measure? Seeing none, members, any questions? Sure. Yeah, Chair.
I have a question for Laura Reinhardt. Thanks for your testimony and for your work. It seems to be, wanted to get just a handle on how long do you think the working group will take to complete the work?
We've identified 500 statutes that reference physicians, APRNs, or PAs, and unfortunately it does take looking at every single statute, so it is a manual effort. We've been meeting monthly, and we've gone through just under 100 of those statutes, so it would be wonderful if we could get through this work by the end of the year. It might take a little bit longer, but we can always piece out that work and give those reports out in increments.
Mm-hmm.
I don't think it'll take more than next year, and we can absolutely provide an interim report before next session.
Thank you.
Mm-hmm.
Members, any further questions? Actually, I do have a question for the Auditor's Office. Thank you for your testimony. As you noted, maybe the Auditor's Office is not the best place to formulate this analysis regarding scope of practice. Would you consider the Legislative Reference Bureau as an appropriate entity to delegate this to?
I wouldn't want to speak on behalf of the Legislative Reference Bureau, but I do know that in the course of their work, they do complete reports on behalf of the legislature.
Thank you. No further questions. Okay, we'll be moving on to HCR 181/HR 186, requesting the Department of Health to conduct a social and financial assessment of proposed mandatory health insurance coverage for weight management medication. First to testify on this measures, we have Don Kurisu, HMSA, with comments. Thank you. Are there any other persons here to testify on this measure? Seeing none, members, any questions? Seeing none, we'll be moving on to HCR 112/HR 118, requesting the auditor to conduct a social and financial assessment of proposed mandatory health insurance coverage for various sexual and reproductive health care services. First to testify on this measure, we have Leslie Kondo, State Auditor from the Office of Auditor, with comments.
Daria Goto on behalf of the Office of the Auditor again. We'll stand on our testimony, just noting that this resolution references two bills for the Auditor's Office to review.
Thank you. Next, we have Jen Wilbur from Planned Parenthood Alliance Advocates in support on Zoom.
Not present.
Not present, we'll be moving on to Don Kurisu from HMSA with comments.
HSA stands on comments. Thank you.
Thank you. Are there any other persons here to testify on this measures? Seeing none, we'll be moving on to HCR 201/HR 205, requesting the auditor to conduct a sunrise analysis on mandating parity in vitro fertilization health insurance coverage. First to testify on this measure, we have Leslie Kondo, State Auditor from the Office of Auditor, with comments.
Daria Goto once again on behalf of the Office of the Auditor. We'll stand on our testimony offering comments, just noting that this resolution references an unidentified Senate bill for us to review.
Thank you. Next, we have Don Kurisu from HMSA with comments.
We'll stand on comments. Thank you.
Thank you. We also have written testimony from the Stonewall Caucus of the Democratic Party of Hawaii in support. Are there any other persons here to testify on this measure? Members, any questions?
Question.
Chair?
You have a question for Don Kurisu, HMSA?
Hi, I apologize, Rep. I'm Jennifer Deesman
I'm
with
sorry.
HMSA.
Sorry
Sorry
about that.
about that.
We just wanted to ask you whether HMSA, just based on your testimony, do you already cover same-sex couples who want in vitro?
We cover the individual member who is a woman who has fertility issues. So we actually cover the member, whether they are in a same-sex relationship or not, if they're our member.
But if the member does not have a condition that it's just because she's in a same-sex relationship that does not allow her to have a normal birth.
So we cover infertility. So we cover infertility conditions and an
So this would not-
infertility condition.
if they did not have an infertility
Correct. It would not be
condition,
covered.
just on the basis of, just being a same-sex couple, they would not have coverage.
Correct, unless the individual themselves has an infertility condition.
Thank
But they
you for-
could be in a same-sex relationship and still
Correct.
have an infertility condition,
Right.
that we would cover them.
Okay, thanks
Yeah.
for the clarification.
Yeah, no worries, thank you.
Okay, members, any further questions? Seeing none, we'll be taking a short recess for decision-making. Recess. I'm going to be reconvening this joint committee with LMG and CPC. First, we'll be taking a vote on HCR 100/HR 107. The Vice Chair's recommendation is to change this from the Auditor's Office to the Legislative Reference Bureau analysis. So we'll be striking all references to the Auditor's Office and inserting language for the Legislative Reference Bureau. Members, are there any comments? Okay, seeing none. Chair for the vote on HCR 100/HR 107 with amendments.
Okay. HR 100, HR 107, as amended, Chair and Vice Chair vote aye. Representative Amato.
Aye.
Representative Bellotti. Excuse Representative Hashem.
Aye.
Representative Hussey Burdick.
Reservations, please.
Reservations. Representative Gates.
Aye.
Representative Lowen. Excused. Representative Onishi.
Aye.
Representative Tam.
Aye.
Representative Perk.
Aye.
Chair, motion is passed.
Committee on Legislative Management, same recommendation with amendments.
Thank you. We're voting on HCR 100, HR 107. Recommendation is passed with amendments. Chair and Vice Chair vote aye. Rep. Iligan excused. Rep. Kitagawa.
Aye.
And Rep. Matsumoto is excused. Thank you.
Thank you. We'll be moving on to HCR 181/HR 186. Vice Chair's recommendation is as we pass this as is. Any comments? Seeing none, Chair for the vote on HCR 181/HR 186 as is.
HR 181, HR 186. Chair's recommendation is to pass as is. During the excused absence of Representative Lowen and Representative Lowen and Bellotti. Are there any no's? Any reservations? Chair, motion carries.
Thank you.
Same recommendation for HCR 181, HR 186,
Okay.
as is.
Thank you. We're voting HCR 181 and HR 186 pass as is. Chair and Vice Chair vote aye. The excused absence of Iligan and Matsumoto. Any reservations? No's? Okay, thank you. It's adopted.
Thank you. Next, we have HCR 112/HR 118. Vice Chair's recommendation is to delete the reference to HB 1179. This is reflecting the Auditor's Office's testimony. So, members, any comments? Okay, seeing none, Chair will be voting on HCR 112/HR 118 with amendments.
HR 112, HCR 112, HR 118 with amendments. Chair and Vice Chair vote aye. Knowing the excused absences of Representative Lowen and Bellotti, are there any no's? Are there any reservations? Chair, motion passes.
Same recommendation with amendments.
Thank you, Chair. Voting HCR 112 and HR 118. Recommendation to pass with amendments, noting the excused absence of Iligan and Matsumoto. Are there any reservations or no's? Seeing none, it's adopted. Thank you.
Thank you. Finally, we have HCR 201/HR 205. Vice Chair's recommendation is to insert reference to SB 993, as right now there is no reference to a bill. Members, is there any discussion? Okay, seeing none, Chair will be voting on HCR 201/HR 205 with amendments.
Okay. HCR 201, HR 205, passed with amendments. Chair and Vice Chair vote aye. During the excused absence of Representative Lowen and Bellotti, are there any no's? Are there any reservations? Vice Chair, your motion passes.
Thank you.
Thank you, Vice Chair. Same recommendation with
Okay.
amendments.
Thank you. Voting on HCR 201 and HR 205, recommended to pass with amendments, noting the excused absence of Rep. Iligan and Matsumoto. Any noes or reservations? See none, it's adopted.
Okay, thank you. This committee is adjourned. Good afternoon. I'm calling to order the House Committee on Consumer Protection and Commerce. It is Wednesday, March 29th, 2023. It is 2:29 p.m. We are in conference room 329. We'll be taking a 2-minute testimony. If you're on Zoom, please mute yourself and keep your video off until it is your turn to testify. If you are having technical issues, please use the chat function to contact our staff. First on the agenda, we have HCR 201/HR 208 requesting the Hawaii State Center for Nursing to convene a working group to study the potential impacts of the state of joining the multi-state nursing licensure compact. First to testify, we have Chelsea Fukunaga, Executive Officer for the Board of Nursing, with comments. Thank you. Next, we have Laura Reinhardt from Hawaii State Center of Nursing with comments. Thank you. Next, we have Jace Mikulanik from the Queen's Health System in support on Zoom. Oh.
Chair, sorry.
Hi.
Appreciate you hearing this resolution and strong support. Thank you.
Thank you. Next, we have Dawn Carisi from HMSA in support. Thank you. We have written testimony with comments from the Hawaii American Nurses Association, Grassroots Institute of Hawaii, and we have written testimony in support from the Hawaii Government Employee Association and Healthcare Association of HMSA, and 2 individuals testimonying in support and with comments. Members, are there any questions? Okay, seeing none, we'll be moving on to HCR 49. This is requesting the establishment of a telehealth working group to examine the impact of widespread telehealth adoption during the COVID-19 pandemic and identify public policy initiatives at the federal and state level to optimize telehealth utilization as the state transitions out of the COVID-19 pandemic. First to testify, we have Kenneth Fink, Director for the Hawaii Department of Health, in support. Okay, not here. We'll be moving on to Dawn Carisi, HMSA, in support. Thank you. Next, we have Matthew Koenig from the Queen's Health System.
I'm Dr. Matthew Koenig. I'm a neurologist at Queen's and the medical director of telehealth. And the current resolution is very important to bring parties to the table to study the impact of telehealth adoption during the pandemic. We saw very widespread adoption of telehealth in Hawaii, and that has persisted. What we don't know is the impact of that on the quality of care for patient safety and cost of care. And knowing that will be very important to inform public policy, both at the state level and federal level, about what waivers and what allowances that were adopted for telehealth during the pandemic should continue beyond the PHE. And so we stand in support of the concurrent resolution. Thank you.
Thank you. Next, we have Denise Conan Lee Lum from the University of Hawaii in support. Not here. Okay. We have written testimony in support from the Hawaii Primary Care Association, Hawaii Substance Abuse Coalition, Hawaii Healthcare Association of Hawaii, National Association of Social Workers, Hawaii Chapter, the Hawaii Psychological Association, HPA Legislative Action Committee, the Hawaiian Island Association for Marriage and Family Therapy. Are there any other persons here to testify on this measure? Members, are there any questions? Seeing none, we'll be moving on to HCR 7 HD1/HR 6 HD1, requesting the Department of Human Services MedQuest Division, in collaboration with the Department of Commerce and Consumer Affairs, to expand the types of qualified providers allowed to provide lactation consultant services for the Medicaid population in the state. First to testify on this measure, we have R. Malia Tom Dinik from the Department of Human Services, State of Hawaii, with comments. Thank you. Next, we have Gordon Ito, Insurance Commissioner from the DCCA, with comments. Thank you. Next, we have Ellie Mulpeter from the Academy of Lactation Policy and Practice in support on Zoom.
Hi, thank you, Chair, Vice Chair, and members of the committee. My name is Ellie Mulpeter, and I'm the Director of the Academy of Lactation Policy and Practice. I'm testifying in support of HR 6 HD1. The Academy operates the Certified Lactation Counselor Certification Program, or the CLC program, which identifies qualified lactation providers. There are currently 161 CLCs in Hawaii, and as we know from their most recently published report, there are 99 IBCLCs as of March 2022. We know from empirical evidence that we need both types of providers and more of them, as there are not enough providers to attend to new families in Hawaii. We support the intention of the resolutions to expand access for lactation professionals, including CLCs and IBCLCs, as this will aid in increasing access to care for families. We've submitted written testimony to the committee, just outlining some clarifying language that could be added to the legislation, primarily to clearly define the CLC professional. Our approach is consistent with the model policy payer coverage of breastfeeding support, also known as the model policy issued by the United States Breastfeeding Committee, which chooses to center the IBCLC and CLC's provider types because they are the only two professional credentials that are accredited independently by a national or international accreditation agency. It's also important to note that as testimony that you might see today emphasizes that adding CLCs to these resolutions may create consumer confusion, the model policy was written by the USBC for the exact purpose of alleviating consumer confusion. To be clear, also, testimony that you may hear today against these resolutions insinuates that this legislation may lead to limiting access to breastfeeding support are factually incorrect. By definition of the fact that these resolutions will be expanding access to lactation providers rather than fewer, there will be no limits for families seeking lactation care in Hawaii. To address other testimony that is going to speak to how these resolutions should focus on IBCLCs only, or open up the ability for other qualified providers to seek reimbursement, we would fully support that reimbursement of other lactation support providers be
My
included in
apologies,
this legislation.
Ms. Maltpeter, your 2-minute testimony limit is up. Can you please summarize your testimony?
Yes, absolutely. We appreciate the committee's consideration of our suggested language and would be happy to be a resource if needed.
Thank you. Next, we have Dawn Karisu from HMSA in support.
Thank you. We'll say our testimony in strong support, and thank you to the Women's Caucus for introducing this.
Thank you. We have written testimony in support from the Hawaii Maternal and Infant Health Collaborative and 2 individuals. Members, are there any questions? Seeing none, we'll be moving on to HCR 42/HR 46, requesting the Department of Human Services to immediately cease intercepting Social Security payments for children in foster care. First to testify on this measure, we have Kathy Betts, Director for the Department of Human Services, State of Hawaii, with comments.
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Daisy Hartsfield. I'm the Social Services Division Administrator, and I'm testifying on behalf of Director Betts. The department did submit testimony. I apologize for the untimeliness of it, and I would like to correct our testimony on both resolutions to correctly reflect that it's to be addressed to the Honorable Mark Nakashima, who is the chair of this committee, which is the Committee on Consumer Protection and Commerce. I did want to add to our testimony that in state fiscal year 2022, there were over 2,000 children in foster care, of which the Department of Human Services was the payee representative of 55 of those children. I'll be available for any questions should the committee have any. Mahalo.
Thank you. Are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Seeing none, we'll be moving on to HCR 39HR 43, requesting the governor to convene a task force to examine and make recommendations on the existing procedures for the adoption of the state building code. First to testify on this measure, we have Nani Medeiros, Office of the Governor, Chief Housing Officer, in support. Seeing that she's not here, we'll be moving on to Tim Lyons from Subcontractors Association of Hawaii in support. Not here as well. We'll be moving on to Stephanie Sakamoto, BIA Hawaii in support.
Greg Thielen from BIA will be testifying.
Oh, okay. Thank you. Greg Thielen on Zoom.
Aloha, Chair, Vice Chair, members of the committee. I'm here in support of HCR 39, excuse me, and I'm the Codes Committee Chair for BIA Hawaii, so I'm available to answer any questions that you might have. Thank you.
Thank you. We also have three written testimonies in support from individuals and one written testimony with comments from an individual. Members, are there any other persons here to testify on this measure? Seeing none, members, are there any questions? Seeing none. We'll be moving on to HCR 99/HR 106, urging the Real Estate Commission to develop policies and programs to inform and educate condominium association owners and board members of certain matters to promote the efficient administration of condominium associations. For us to testify on this measure, we have Keaton Kleinhans from the Real Estate Commission in support.
Morning, Chair, Vice Chair, members. Keating Lannis on behalf of the Real Estate Commission. You have the Commission's written testimony in support of the resolutions. We do indicate our continued development of educational programs for the condo owners and board members, offered largely no cost for those in registered associations. Since the various studies in the 90s and subsequent recodification of the condominium law in 2006, we drafted a couple of 70-page guides covering owner and board member rights and responsibilities, basic governance, different types of governing documents, assessments, and meetings, dispute resolutions, other topics, fiduciary duty, proxies, document requests, further condensing the information into bite-sized brochures and YouTube videos for audiovisual learning, and then circling back with comments of any law changes. We really appreciate the discussion with the condo community and stakeholders and how we can improve our programs and outreach efforts, and I always appreciate any further suggestions we can get. Thank you. Available for any questions.
Thank you. Next we have Dale Head, an individual in support on Zoom.
Okay, well, he has a condominium HOA for 3.5 decades, and amazingly bad stuff happens when we have volunteer board members who try to take advantage of the HOA. They have their hidden agendas, and we're not good. There's no training is required. It's absurd. Chris, we got one gal went to a Hawaii Disability Rights Center, claimed her husband inhaling smoke was bad. She got money. She got a settlement. I organized a homeowners revolt to get rid of a bad resident manager. Bastard, pardon my language, he sued me and some other people. Cost us $100,000 in legal fees. The state does not protect volunteer board members. This is nuts, okay? It takes the joy out of condo living when you have people playing games to make money on you, all right? So we really need this training. Just as medical people get trained, board members need training too, so they know what the hell they're doing. Thank you.
Thank you. Next we have Greg Masikian, individual in support on Zoom.
Aloha, Chair, Vice Chair, and members of the committee. My name is Greg Masikian, and I'm giving testimony as an individual in support of HCR 99 and HR 106. While it is appreciated that there is a formal statement by resolution, your committee and others within the legislature had numerous opportunities to hear and pass bills that would have afforded better consumer protections to condominium owners throughout Hawaii. Some were never scheduled for hearings, and others have become resolutions. To highlight just how bad things have gotten, last week I was elected to my condominium association board as treasurer. On the day I was elected to the board and prior to the election, I discovered that our management company overseeing our association had an inactive license, which indicated unable to practice. I also discovered that their license had in fact been inactive since January 1st of this year. They are one of the largest management companies in Hawaii, and this impacts thousands of condominium owners and billions of dollars of property. I have a fiduciary duty to act on this, and I ask that our legislators please assist me. I have already informed some of our legislators earlier this week, including Senator Sharon Moriwaki. Yesterday, I also received an email from our association board president, who has been on the board for 5 years. His email stated that there are no formal instructions or guidance for new board members from our management company, and this has been the case for as long as he has been on the board. I hope that in 2024, our legislators will support condominium-related bills that will provide better consumer protections. Mahalo.
Thank you. We also have written testimony and support from 3 individuals. Are there any other persons here to testify on this measure? Seeing none, members, any questions? Seeing none, we'll be moving on to HCR 41/HR 45, urging the Public Utilities Commission to reevaluate and adopt administrative rules relating to the removal of abandoned or double utility poles, lines, and equipment. First to testify on this measure, we have Dean Nishina, Acting Executive Director for DCCA, Division of Consumer Advocacy, with comments.
Mickey Knox for the BCA. We stand on our written comments.
Thank you. Next, we have Leo Sunshin from the Hawaii Public Utilities Commission with comments.
Aloha, Chair, Vice Chair, members of the committee. My name is Anand Samtani with the Public Utilities Commission. On behalf of Leo Sunshin, we stand on our written comments, our testimony comments, and I'm available for any questions. Thank you.
Thank you. Next, we have Paul Nakagawa from Hawai'i Electric with comments. On Zoom.
Hi, good afternoon, Chair, Vice Chair, members of the committee. My name is Paul Nakagawa on behalf of Hawai'i Electric Company, testifying in support of the intent of the 2 resolutions. So we agree and we know that double poles are a problem and continue to be a problem, but I assure we are committed to addressing this issue and improving the coordination between our attachers as well as all the other entities that are on our poles and cleaning up the backlog of double poles. So I will be available for comments or questions. And thank you for the opportunity to testify.
Thank you. Let's see, that's all the testifiers we have. We have 1 written testimony from Hawaiian Telecom with comments. Are there any other persons here to testify on this measure? Okay, seeing none, actually, I do have a question for the Public Utility Commission.
Yes.
So in this resolution kind of outlines the National Electric Safety Codes that the PUC adopts. The current version is 2003, if I'm correct?
2002 was in the HAR.
Okay, 2002. I'm just curious, it's 2023 now. It seems a little outdated. Does the PUC have any intention to kind of update this national standard?
Yeah, in our testimony, we state that we are reviewing the NESC, the code, the 2003, and then we are trying to figure out how we want to adopt that into the HAR.
Thank you. Is there any timeline for when that might be adopted?
Well, I mean, we're looking at it right now,
Okay.
actually. And then the thing is that the actual rulemaking part takes a little time. I don't know if you know what that, the HAR. So I'm not sure how long that will take, that part. But we are definitely looking at it. We actually are reviewing, our engineers are actually reviewing the NESC, 2003. Yeah.
Okay, thank you so
version.
much.
Yep.
Appreciate it.
Sure, thank you.
Okay, members, any other questions? Okay, seeing none, we'll be moving on to the last item on the agenda, HCR 9, requesting that the state auditor conduct a sunrise analysis of funeral directors and cemetery salespersons. First to testify on this measure, we have Leslie Kondo, State Auditor from the Office of the Auditor, with comments.
Good afternoon, Chair, Vice Chair. Daria Goto on behalf of the Office of the Auditor will stand on our written testimony offering comments, and just note that the bill that the Auditor's Office is asked to review does direct the Death Care Industry Board to establish the specifics relating to the proposed regulation, and we are concerned that we would be unable to completely analyze whether the regulation proposed is consistent with the state's policy regarding regulation of professions and vocations. I will note one other thing that was not in my written testimony, and I apologize for not raising it earlier, but the Office of the Auditor did complete a sunrise analysis in 1981, and it's report number 1981-8, and I can make that available to the committee.
Thank you.
Thank you.
Next, we have Chelsea Fukunaga, Executive Director from DCCA Cemetery and Funeral Trust Program, in opposition. Thank you. Okay, sounds good. Okay, members, we have one written testimony in opposition from the Hawaii Funerals and Cemetery Association. Are there any other persons here to testify on this measure? Seeing none, members, any questions? Okay, members, actually, I would like to go back to, what was that, HR 6? Okay, thank you. And we'll be taking a testifier, Crystal Wilson. I'm sorry, from Lactation Access Transforming Communities in Hawaii in support.
Thank you so much. I appreciate that. I'm not sure how I was missed in the earlier testimony. I've flown over from Kalakekua, Hawaii today. Our project is a joint project of Early Childhood Action Strategy and Breastfeeding Hawaii. And we are in strong support of the measure and the intention of adding lactation access and working with MedQuest to do so. And you'll note in several of the testimonies, and in fact, we can concur with all of the Hawaii testimony in terms of opportunities to increase access, and particularly to recognize that our clinical care is best provided by the board-certified lactation consultant, or IBCLC. And as noted by the Academy of Lactation Practice and Policy, there are real concerns in Hawaii about the continental organization coming in with a private and relatively closed certification. In Hawaii, we are blessed to have an Indigenous breastfeeding counselor certification, a breastfeeding peer counselor certification, and we appreciate that we have a number of mid-level and entry-level providers who should be included in the access to care. But we do want to raise some alarm and concern about a continental organization that has sort of jumped into this bill and created some confusion and concern for the folks who have been working steadily around this. And we're funded by Robert Wood Johnson Foundation to bring together communities, particularly neighbor islands, and our Indigenous Pacific Islander and Native Hawaiian communities, to make sure that we address the particular disparities in access to care and the chronic disease disparities that result from inadequate breastfeeding. And I really appreciate you taking time to hear that particular concern. We support the original measure. We look forward to working together with DHS and with the consumer protection folks as well to make sure that we move access forward, and did just want to express our concern about some of the continental testimony that has come in. Thank you so very much. I appreciate it.
Thank you for your testimony, and I apologize for that oversight. Members, are there any questions on HR 6, HCR 7? Okay, seeing none, members will be taking a short recess for decision making. Recess. Okay, I'm reconvening the House Committee on Consumer Protection and Commerce for decision making. First, we have HCR 204/HR 208. This is requesting the Hawaii State Center for Nursing to convene a working group to study the potential impacts to the state of joining the Multi-State Nursing Licensure Compact. The Vice Chair's recommendation is that we adopt the recommendations from the testimony of the Hawaii State Center of Nursing. We'll be changing the due date essentially to 20 days prior to the convening of the regular sessions of 2025 to give them a little bit more time to do their due diligence with this issue. Members, is there any discussions? Okay, seeing none, Chair will be voting on HCR 204, HR 208 with amendments.
Okay. Voting on HR 204, HR 208 with amendments. Chair and Vice Chair vote aye. Representative Amato.
Aye.
Representative Bellotti.
Aye.
Representative Hashem. Representative Hussey Burdick. Excused. Representative Gates.
Aye.
Representative Lowen. Excused. Representative Onishi.
Aye.
Representative Tam.
Aye.
Representative Perrick.
Aye.
Okay. Chair, motion is adopted.
Thank you. Next, we will be looking at HCR 49. Vice Chair's recommendation is to pass this as is. Members, any discussions? Thank you. Chair will be voting on HCR 49 as is.
HCR 49, Chair and Vice Chair vote aye, knowing the excused absence of Representative Lowen. Are there any noes? Are there any reservations? Motion is adopted. Hussey Burdick is also absent. Okay. Okay, Chair, motion is adopted.
Thank you. Next, on HCR 7 HD1 / HR 6 HD1, Vice Chair's recommendation is that we incorporate some amendments to this measure based on some of the testimony from ALPP as well as representatives from the Women's Caucus. I'd like to make amendments striking the language starting on line 25 to expand the types of qualified providers. I'd like to also strike language on line 28, credential, and replace that with expand access to. Finally, we'll be striking language beginning on line 30, or are certified lactation counselors. Okay, members, are there any discussions? Okay, Chair will be voting on HCR 7 HD1, HR 6 HD1 with amendments.
Okay, voting on HCR 7, HCR 6, knowing the presence of Representative Hussey Burdick and the absence of Representative Lowen, are there any noes? Are there any reservations? Chair, motion is carried.
Thank you. We'll be moving on to HCR 42 / HR 46. Chair's recommendation is to pass as is, though I'd like to note in the committee report based on DHS's testimony that there should be some examination into the financial implications of this policy. So that will just be in the committee report. Okay, Chair voting on HCR 42. Sorry, members, any discussion? Okay, we'll be voting on HCR 42 / HR 46 as is.
Okay, voting on HR 42, HCR 42, HR 46 as is, knowing the excused absence of Representative Lowen, are there any noes? Any reservations? Motion is adopted.
Thank you. We'll be moving on now to HCR 39 / HR 43. Vice Chair's recommendation is to pass this one as is. Members, any discussion? Seeing none, Chair for the vote on HCR 39 / HR 46 as is.
Okay, Chair and Vice Chair vote aye, knowing the excused absence of Representative Lowen, are there any noes? Any reservations? Chair, motion is adopted.
Thank you. Next, we'll be moving on to HCR 99 / HR 106. Vice Chair's recommendation is to pass this as is. Members, are there any discussions? Okay, Chair taking the vote for HCR 99/HR 106.
Okay, voting on HCR 99, HR 106, knowing the Chair and Vice Chair vote aye, knowing the excused absence of Representative Lowen. Are there any noes? Any reservations? Motion is adopted.
Thank you. Next, we'll be moving on to HCR 41/HR 45. Vice Chair's recommendation is to pass this as is. Members, are there any discussions? Seeing none, Chair for the vote on HCR 41/HR 45.
Okay, voting on HR 41, HCR 41, HR 45. Chair and Vice Chair vote aye. Are there any noes? Any reservations? Motion is adopted.
Thank you. Moving on to HCR 9. Vice Chair's recommendation is to defer this measure based on the testimony from the Auditor's Office as well as DCCA. I think there are other ways that we could work on some issues surrounding this particular industry and licensure. Well, that's it. Thank you so much, members. This committee is adjourned.